After Haemophilus influenza, the next bacteria we are going to discuss is the Bordetella Pertussis. As we have known that Bordetella Pertussis is a gram-negative Coccobacilli along with the Haemophilus influenza, and it has a typical toxins. So the first toxin is pertussis toxin, second toxin is adenyl cyclase toxin, and third toxin is tracheal cytotoxin. So what it actually causes, first the tracheal toxin goes to the respiratory ciliated epithelium and destroy it. After the destruction of respiratory ciliated epithelium, the normal protection barrier of respiratory tract is impaired. So now the bacteria, when the respiratory ciliated epithelium is impaired or it is damaged, then we cannot trap the bacteria in the mucus lining of the respiratory epithelium. So now the bacteria has an easy approach to the inner bronchioles and lower respiratory tract. After the tracheal cytotoxin destroy the tracheal respiratory epithelia, pertussis toxin goes, and pertussis toxin, it inhibits the inhibitory part of the inhibitory subunit of the transmembranal G protein system, which means that it activates something, and it activates actually the adenyl cyclase enzyme, which leads to increase CAMP level, and this increase in the CAMP leads to inhibit the phagocytic activity of the phagocyte like complement, macrophages and neutrophils. So now there is a lot of bacteria in the lower respiratory tract, and there is no one there to defend that bacteria. Now bacteria is accumulated, or bacteria goes into the respiratory epithelium, and now it causes the infection. So there are three stages of this Bordetella pertussis infection. First one is catarrhal stage, which is the low grade fever, and it is also with the coryza. After catarrhal stage, there is a paroxysmal, or there is an episodic stage in which there is episodes of intense coughing followed by inspiratory woof. That's why it's known as whooping cough. And also there is a post tussive vomiting. So the person is episodically, there is an intense cough, and also there is an inspiratory whooping, and also after the cough the person vomit. Then after paroxysmal state we have the convalescent state. In this convalescent state there is a gradual recovery from the chronic cough or 100-day cough. And Bordetella pertussis is very much common in those adults, especially adults, which cannot continue the booster vaccination of diphtheria toxoid acellular pertussis or the diphtheria tetanus acellular pertussis vaccination. So that's why this vaccination is very much common, very much important in order to cope with this Bordetella pertussis infection. So we can prevent this by vaccinating our children from this vaccinating from our children with this, which helps to cope with the pertussis, tetanus, and also diphtheria. And if the person is in an unvaccinated child or a person which forgot to take the booster vaccination of this, is very much likely to have pertussis infection. So if he is infected, then we can treat it with macrolides. After Bordetella pertussis, we have Brucella, and the Brucella is very much common in the unpasteurized dairy products, especially the milk. It is also known as the undulating fever, and it is also give the granuloma like symptoms like fever, then night sweats, arthralgia, etc. So for undulating fever, we can diagnose it as Brucella. The next one is we have Pasteurella, and this Pasteurella multicodi, it can cause, it is first of all very much common in the cat bite, also common in the dog bite, but cat bite, most common infection causing pathogen is Pasteurella, and it has a 24-hour cellulitis, and it is the wound is also very much mouse like odor, which indicate that Pasteurella is indole positive. Then we have the Francisella, and this Francisella is very much the vector for this Francisella is the rabbits, wild or rabbit, the person dealing with a lot of rabbit. So rabbit is the most common vector for Francisella. So this is all Francisella. Then we have tick and also deer fly, and it is called tularemia. So this is all about the Diplococcus, the Coccobacillus part of the gram-negative bacteria.